My name is Steve Daly. I'm the Vice President of the FIA. Melissa is taking off today, Melissa Clark, because snow's on the way, and that's what she does at Clark Enterprises for a living, is supply salt and ice melting materials to people that need it. I don't wish her a bad go at this, but I kind of hope we don't get what they're calling for. And then Mike's on something important. Mike Martin, he's the president. So if there's any Fairfax Industrial Association board members here, there's a couple I can see. I'm going to stand up and wave. Rachel Chambers, she's our secretary, or treasurer. And Tara Laws, she's on the board, and then myself. I might introduce my son too, Andy. This is his first FIA meeting. Andy Daly, he's a mechanical engineer, and he's going to try taking over for me when I go away in about a year. So he's in training right now. So you'll see more of him. What else? Is there any housekeeping? There's restrooms or around the corner and that way, or right through this door.
Yeah.
Okay. You don't have time to make it that way. You go straight through that way. I want to thank Kansas Community College for hosting this event. I can't remember. Have we had any, Rachel? Have we had any meetings, face-to-face meetings?
We did in December, we did November, October was the festival, and then we had one in September. I think September was the first one we had that.
Okay. We got the festival. Okay. So it's been a while. It's good to be kind of out and about. And anyway, we appreciate Kansas Community College hosting today. Our speaker is Dr. Tammy Bartunek.
Yep, close enough.
Close enough, okay. She's the Vice President of Strategic Initiatives and Outreach here. So she can tell us what that title causes her to do. And also, I mentioned afterwards, if you haven't already, there's going to be some door prizes, courtesy of Kansas Community College. So if you haven't dropped your business card at the front table there, please be sure to do that. And on that note, I guess I'll turn it over to you, Tara. Are you going to have time for some questions after your presentation? Great. Okay.
Thank you. Thank you very much. Okay, hi everybody. Thank you for coming out today. My name is Tammy Bartunek, and I am the Vice President for Strategic Initiatives and Outreach here at Kansas City, Kansas Community College. And interesting question, what does my title cause me to do? I think of that often. I just had a meeting with my meeting supervisor, who is the college president, Dr. Gray Mosher. I hope you all at least have got to meet him. At some point, he gets around town, well, before COVID, a lot more than he does now, everything being virtual, or most everything being virtual. And we joke that I currently am working without a job description because he says, you do everything that I don't want to do or don't have time to do. So it's kind of a catch-all, the other duties. That's pretty much what I function under. But my primary objectives are to support our college's strategic plan, making sure that we stay on target and on task with our goals and priorities. I get a chance to talk to community groups about what the college has been up to, what our plans are for the future, and also to let everybody know that, of course, the college is still here, right? We're open. We are what I believe is a key community support mechanism. We offer training that is non-credit. We also offer training and education that is credit-based. That being, we offer technical programming here at the Tech Center, which is technical certificates in a variety of areas: welding, electrical technology, machining, CNA, physical therapy assistant, just a number of programs. And most of them can be completed in less than a year if you attend full-time, the certificates. And then our main campus, which is just about a mile to the west, we offer academic programs and associate degrees. So truly we have accounting to welding, honestly. So if you have an interest or a need, if you have a business that needs technical folks, if you have a business that needs accounting folks, or marketing, truly think of us. We're local, we're at low cost, but we're still really high quality. And beginning this year in 2022, I hope that you start to see, we turn 100 next year in 2023. So we will be having a centennial events that you'll hopefully start seeing and participate in starting this year, running through 2023. So we've been here a long time, and we hope to be here for another 100 years supporting our business community and what your needs are. So that's my plug. Woo! There we go. Thank you, Patrice. Need my girlfriend.
Second.
Okay. So let's see if I can get this to go. And I did not memorize this, so I will be cheating and looking at my slides. Okay?
Okay.
So, thank you. So, what I want to talk to you guys about today primarily is our Community Education Health and Wellness Center. This is a concept that our president, Dr. Greg Mosier, came up with probably a year after he took our presidency. He's been here for 3.5 years. And as you came into the room, over here to my left, you'll see some 20-30 posters. And those are renderings of what this facility is planned to actually look like. And the location is in downtown KCK, between 6 and 7, and Nebraska and State. Okay? And we do have an advisory council put together for this project. And on this advisory council, we have members of the college, members of the downtown community, the shareholders. We have members from the faith-based organizations throughout the county. So we really did try to have a very broad reach, as well as Health and Human Services on the committee, to make sure that we are hitting all of these services and wraparound needs of our community members of downtown. So our vision is to provide hope, end generational poverty, improve the quality of life, and increase the socioeconomic mobility of our residents living in and around downtown KCK. Kind of a heavy lift, but we are happy to take on this challenge with our partners. Speaking of our partners, so in this project, we are working with Kansas City Campus Public Schools, USD 500, the YMCA, SOAP Health, Wyandotte Behavioral Health Network, and Community American Credit Union. And as we kind of progress through the presentation, I'll let you know some of the details of why and how those particular partners have been selected for this project. Okay. So, the reason. Anyone wondering why I'm taking on such a big project? Why? Thank you, Stephen. So, the reason is, if you know anything about Wyandotte County, which I know you all do, when you look from the west of Wyandotte County and you look to the east, it's quite different. There's a lot of differences. So, as we were looking at this, the western 4 zip codes, there with English proficiency, it's 2,540 folks on the western side that lack English proficiency. But yet, when you cross over into the eastern 6 zip codes, this jumps up to nearly 20,000. And that can be a barrier to employment, right? Again, working full-time but yet living in poverty. So folks that are working full-time, they're working maybe 1, 2, 3 jobs at a time. Western 4 zip codes, 3,800 folks fall into that category. Eastern, almost 18,000. So you're starting to see the theme emerge. Children under 18 living in poverty. Western side, 15%. Eastern side, 45%. And there's no physical barrier, right, between our east and west side of the county. But somehow, things just aren't working the same on the eastern side. Post-secondary attainment. West side, 25% of folks have at least a secondary educational credential. Eastern side, 10%.
By secondary, were you referring to college? Or
Post-high school.
Post.
Post-high school. And then median household income, western side, 64,000, all round a little bit. Eastern side, 39,000. Significant differences, right, between east and west. So when our president, Dr. Mosier, really started to gather this input, working a lot with Greg Kendall in the back at Greg, working with Mark to really get good, solid data, his brain about popped out of his head. He's like, what is happening? We need to help fix this. We are the community's college. That's why we're here. So he started to devise this plan for the downtown project. Median household incomes, again, here is broken out by zip codes. And I don't think I need to go into this into great detail, but y'all can see the western side, I call it Dana, the western side here, and broke out by zip codes. You can see the amounts, and then eastern side, again, such a difference, 64,000 versus 39,000. And a lot of that's related to the very first slide, about English skills, working full-time, living in poverty, just a lot of factors, right, that play into that. Oh, and that was us. So the college is located here. The new site will be located here. Okay, so Wyandotte County opportunities. Whoa, too fast, Tammy. Slow it down, girl. So, on average, there's 32,000 jobs available. And if you look at the capital investment, I was like, capital investment per year, we've had some better years than others, right? Having folks invest capital in Wyandotte County. In 2020, the year of COVID, right? 849, almost $1 billion invested in Wyandotte County. So we are an area of interest for a lot of economic development. We know we have folks that love Wyandotte County that live here and work here, and we want to help those folks have better employment, gainful employment, and language I like to use, I like to move away from like livable wage. You've all heard that phrase. We all need to have a livable wage. Well, I think a better language is successful wage. And that's different from person to person. It talks to equality, right? So what is my successful wage? May be different than what your successful wage is, but we want to help you get there. So Wyandotte County opportunities again by industry. Management is number one in terms of pay. I'm looking at salary amounts, I should say. 2 is manufacturing, and number 5 in here is construction. And those all areas at the college, those are programming and training opportunities that will be involved in our downtown location. So economic opportunities. I wasn't even aware of this until we started really digging into this data. But Wyandotte County, we have the 3rd top weekly wage in the state. Right? We have the 3rd top weekly wage in the state. But in our state, we're 104th in overall health rankings, 104th in quality of life, 104th in the health factors, and 104th in socioeconomic factors. But yet, we have the 3rd highest salary rate in the state. Is that confusing to anybody other than me?
Aren't there like 104 counties?
Yes! You should get a door prize. So, less than a third, about 29%, of all of the about 71,000 workers in Wyandotte County live in Wyandotte County. 71% of all county-created wages leave the county. You get that? So the folks come into Wyandotte County, they have great careers, because again, we have the 3rd highest weekly wage, right? So 71% of the folks having these jobs aren't from Wyandotte County. They come and work here, they enjoy our community, they enjoy what we offer, and then they go home. That bugs me. So loss in revenue for Wyandotte County, $35,000 as a median cost. That's per person per year. So if you look down towards the bottom, if we kind of go out 5 years, $1.2 billion in loss to Wyandotte County. So now the good stuff, right? So these are images of what we are proposing that our downtown center look like. We really wanted this to have an appearance of being a beacon downtown, inviting individuals to come in, looking through the windows and wondering what the heck is going on in there. You know, really be a good hub, a community hub, a hub for training, a hub for commerce, a hub for folks earning their successful wage. And if you look real close here, this top left picture of Mike, that's Dr. Mosher. It's really not, but I tell that to people all the time. And here's just another angle.
Craig Kendall. So it is.
Oh, it is Greg Kendall. I should just say it's Greg. And then people could discern if it's Mosher or Kendall. That's a great idea.
Huge bike rider.
Huge?
Huge.
Huge.
I rode a bike once.
And again, just to highlight our partners, Wyandotte County Health Network, the YMCA, Swope Health, Community America, and USD 500. So what we, the college, what we will be primarily focused on will be English as a second language. Again, you go back to the first slide we talked about. General education diplomas, helping folks finish their high school. Administrative office professional, because that is one of those top 5 jobs that we looked at, I think in slide 8 or 9 or so. Advanced manufacturing, number 2, profession, right? Associate arts transfer programs and associate science transfer. And what that means, folks that they know they want to get a bachelor's degree, but they can do the first 2 years with us. And they can get their associates done, take those credits, and roll them up to a university and save substantially on their bachelor's degree. So, as a little side note, I'll tell you a little story. So, I have 2 kids. First one started here with us. He'll be 25 this spring. Who said, oh? Is it you? I know, right, Patrice? He's going to be 25. So, he started here with us. He did our electrical technology program. Then he did our HVAC program. And then he did this transfer associates. So he did all this, and because I also work here, we get a discount on tuition fees and all that. So he left here, no cost to him, right? Because it was covered by my benefit. So he took all that, he rolled that to a university, started as a junior, finished his bachelor's in project management. He now works at Cerner. He makes more than I made with my MBA. And I think in total it cost him, in a loan, because he also paid when he went for his last 2 years, I think he had a loan of like $8,000. Right, so it works. My point is it works. We have the formula. We can help students other than just my kid get there, right? So, sorry, little side note, proud mom moment. Thank you for letting me say that. So, I know, right, Chris? Now, he is single, so if y'all know anybody?
I have a single 24-year-old daughter who's a second grade teacher.
Yes, we can talk. We will talk. Yes. Don't leave. Okay.
It's all about networking.
It is, right?
Door prize.
Door prize. I love it. Very good. Not that I'm not calling you, but gifts to get your child.
Oh, endowment.
Endowment? Is that it? Dowry. That's it. Okay. So if you ever meet him, don't tell him we had this conversation. Okay. So sciences, biomanufacturing, of course, commercial construction technology, STEAM-based, and that's STEM just with arts added to it. In case you guys haven't heard that phrase before, and of course welding. The YMCA, what they're going to provide in this new facility will be active adult programs, careers at the Y, Child Watch. The Child Watch is important because it'll be a drop-in environment, so students that want to take our classes, can drop off their kiddos. I think, I don't want to mislead or misspeak, but I think it's anywhere between 2 to 4 hours to allow this kind of drop-off daycare situation so students can take our classes. Chronic disease prevention, again, we're 104 health factors in Wyandotte County, so they'll be offering all of this services to our community members. Living and lifestyle education, exercise classes, nutrition, volunteerism, weight control, youth activities, and enrichment. All of these things that were identified as wraparound needs for the downtown area. So that's why the Y is going to be a major partner in this project. Wyandotte Behavioral Health Network also identified issues about health and mental health. So what they will be doing, providing individual, group, and family therapy sessions, crisis services, parenting classes and support, case management, and permanent housing placement services. Working with their network of connections, right, to help these downtown community members. So health, again, we still have 104, right, in health-related areas. So they will be a primary health clinic, children's health, dental services, emergency dental, and women's health. And they are a qualified federal provider, so a lot of this can be at free or reduced cost. We will be a driver for economic and social mobility. I mean, how can we not with all these partners put into place, right? And such a great need downtown. So, Community America Credit Union, did anyone wonder why in the heck are they bringing a bank into this? Well, what we want these folks to get their training that they want. We want them to have their successful wage, and we want them to know how to invest that. We don't want it to be a week-by-week paycheck situation. We want to help them know how to understand finances, right? Because not everybody has someone that can help explain how to build a checkbook. Back in the day, what's your tier count, right? Oh my God, accounting 1. So that's why Community America Credit Union is going to be able to work with us. They will help elevate individuals' financial success. They will provide management services, personal finance seminars, and investing information, and also small business loans. Perhaps some of these students that get our program and training or degrees, they want to open up their own small business. Anyone in here own a business? I'm just curious. Anyone? No? Okay. But being in Fairfax, someone who owns
Once I enroll in the
businesses.
program, I'll do it.
Yes, that'd be great. That'd be great. So the location will be, again, downtown KCK, between 6 and 7, between Nebraska and Kansas. And again, here's some of the renderings. So here, this top left picture, what you see outlined in red, we are proposing that to be underground parking, because parking downtown is extremely limited, and we have to have so many spots for how many guests you expect to have in your facility. So we do plan to have that as underground parking. 129,000 approximate square feet for the buildings. And again, we do hope and expect this will really help to transform our downtown KCK. Oh, now it comes up, underground parking. Right? So, community impact. The first column on the right side, projected people served annually. With us and with all of our partners, we're expecting in the first 1 to 3 years to serve a little bit more than 14,000 individuals in this entire facility. Going out 5 years plus, about 31,000. So that'll be 31,000 people coming into downtown KCK, receiving training, education services, healthcare, whatever they're visiting for, into our downtown KCK. That's exciting. So, new job creation. This is even more exciting. I almost swore. This is even more exciting. So, new job creation total will be 54 in July 21, projected. No, that's wrong. I'm sorry. These numbers were prepared as of July 21. We are proposing new job creation will be 54. Employees on site in the facility, 151. and then full-time on site will be 116. So as the construction project is ongoing, that's what we expect to have during that construction phase. Okay, so how in the heck are we going to pay for this then? All right? Hopefully you guys brought your checkbooks today. Please, I hope you did. But we are in the middle, we're towards the beginning, about a third, in a capital campaign to raise funds for this downtown project. Our proposal is to raise private and public funds to build this facility. So we are not asking for a mill levy increase for this. We are taking on a huge capital campaign. So the college and our board of trustees has already promised $10 million towards this project. We are looking at, of course, philanthropy and our partners as well. They're undertaking their own capital campaigns. Each partner is working on about an $8 million campaign for their portion of the project. Oh, I didn't tell you this. It's not a secret. I just forgot to tell you. Although we are the college, we're kind of spearheading this, we're not the sole owners. All those partners that I talked to you guys about, they own their space. So we are a majority owner, but all of our partners actually own and will operate their space. Local and state funding, we're hoping to get about $25 million from local and state public funds, $3 million from federal funds, and $3.5 million in new market tax credits. So that is kind of our game plan at the moment. Of course, it will ebb and flow as budgets become created, state budget, federal budget. So once we have a better idea, we may have to ebb and flow, but we are, again, not looking to raise the mill levy, because that's something that I get asked a lot, or sometimes get yelled at, don't raise my mill levy, I'm not. Tammy can't, or board of trustees could, but that is not the plan. Repeat, we are not raising the mill levy. Oh,
You're not raising the mill levy.
Thank you, Greg. And here's project ownership. So KCK will own about 59%. The Y will own their footprint at about 12%. Health Network 12%, SWOPE 12%, and then CACU about 5%.
Where's the 25 million public funding come from?
We are looking at different grants, different funding opportunities, applying for a fund for ARPA funds, SPARK funds, things like that. So right now, this is where we are as of December 16th. Again, we have pledged as a college $10 million. We have a pledge from Sunderland Foundation for $10 million. Community American Credit Union, they're self-funding at $3 million. We have 1.8 of private funds, 900 from Unified Government and the BPU. Tax credits about 197,000. Local public support 500. So we're at about 26 million right now towards the project. So on our way, but not quite there yet. Community project funds. We've had several meetings with our federal delegates. We actually have been to DC to talk about this with our delegation. Sharice Davids, Representative Sharice Davids, she is considering a $1.9 million project fund in her budget. And we also have applied for federal EDA grants of $3 million, and that'll be primarily for machinery, equipment, things like that. So total pending right now is $31 million that we have applicant asks. Okay, this is kind of the boring stuff, but if you guys are interested, this is the timeline. So we are, where are we? We are January 22, so we're about here. So we are still in the waiting to hear from EDA about our grant funds that we requested. So we are hoping to have this project up and running so we can be in the facility by August of 24. Oh, I guess that's it. How are you on time? Am I good?
I think you're good.
Okay. Oh, that was 30 minutes. So if you have questions, I'd be happy to try to answer them.
So how far along do you need to be with your funding before you demolish what's there on the property?
So we have to be at 70% funding before we can do that. Well, I thank you guys for your time. If you have questions in the future, please give me a call. If you want to talk about the project, if you know someone that might have an interest in helping us with the project, either, of course, with funding or just an interest in talking about who these partners are, please let me know. Because we really want this to be a community-driven project. That's where it started.